Hey, this is Dr. Jerry Williams with Urgent Care 24/7. I want to talk to you about just a super quick update here on a new COVID symptom. Now, before we go into the new COVID symptom that I want to talk to you about, I want to hit on the COVID symptoms that you need to be looking for. Most everybody might know this, but it's good to reinforce it, especially with the Delta surge, this new spike in activity with the pandemic. So let's run through just some lists, and I'm going to be looking down at this list here because I want to make sure I don't leave anything off. First of all, fever, chills, very common, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, seeing a lot of that, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. The symptoms for when to seek emergency medical attention are trouble breathing, persistent pain or pressure in the chest, new confusion, inability to stay awake or to be awakened, and pale gray or blue colored skin, lips, or nail beds, depending on your skin tone. Now, the new symptom is actually not an emergency symptom, but it's a symptom that's being noted with the Delta variant, and it's also being noted in patients that are immunized and are becoming infected with the Delta variant, or these kind of breakthrough infections. It's sneezing. In Great Britain, they've noticed that this is a symptom that is very common in patients that are immunized and do get COVID-19, despite being appropriately immunized. They're presenting with symptoms of sneezing, and there's some confusion thinking that it's the patient's allergies, when in fact the sneezing is actually, we realize now, is a presenting symptom of COVID-19. So I wanted to make sure I threw that out there. If you're sneezing, keep in mind that could be a symptom of COVID-19. And I would encourage you to get a COVID test immediately if you think you may have COVID. And in this day and age, with this current surge, whether you know you've been exposed or not, as virulent or as the Delta variant is, it's important for you to get checked if you've got any of these symptoms, because it could possibly be COVID. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.